In this segment, we're going to demonstrate a muscle energy technique, again, to the upper thoracic area, T1 through 4. We'll use T4 this time as the example. In this case, we're going to say that the dysfunction is T4 flexion, side bent right, rotated right. So therefore, our barriers are extension, side bending, and rotation to the left. So we have an option here in terms of how we do it. What I'm going to show you is two hand positions. Some people will just use the head as we used in the other segment, but sometimes it's a little more difficult to use the head and the neck in terms of controlling into an extension position. So we have two options. We can ask our patient to cross the arms in front of him, drop his forehead onto his forearms, and then we'll control the movement up of the extension by lifting his arms up and down this way, or he can do a cross X type of a V thing and do it that way, and then I can control this way. Now, from the posterior aspect, with our patient in the most comfortable position of having their arms folded, we're going to again just drop the head a little forward to identify that C7 T1, and then count down to the T4 area that we said is the dysfunctional segment. We've done our motion testing there previously, so we've already determined it's T4 flexed, side bent right, rotated right. And what we're going to do now is take the patient into an extension left-left position. Since I'm standing here, I'm going to try to move over here because sometimes it's easier to turn towards the rotational barrier. And I'm going to reach under his arms in the front, let the head drop forward, and now what I'm going to do with the patient's arms, I'm going to extend his upper thoracics and sink in to meet that extension barrier there. There it is. So I feel, just let your head float. That's it. Good. Now I have him, and now I'm going to side bend him left to that segment, rotate him left to that segment, and now I'm going to ask the patient, and since I'm lifting him up, he's going to gently push down but also turn towards the right barrier. That's it. And relax after 3 to 5 seconds. And then I just see if I have any more freedom into extension, which I do. A little more side bending left, rotation left barrier. Okay, turn down into the right again. And relax. And again, look for that little feather edge. So you see I'm not moving them all that much. And one more time. You would repeat this 3 to 5 times. Each contraction is 3 to 5 seconds. And relax. See if we, that's good. You can continue this as long as you continue to move through the barrier, you can do it. Now remember, it's a feather edge barrier. You're not into a big hard barrier here. And then after you're finished, just recheck your range of motion as you would have done originally in terms of making your diagnosis. So that's again a type 2 dysfunction, but this time we had a flexion, side bending right, rotation right. So we had to meet an extension, side bending left, rotation left barrier.